The goal of CMI is that we have all of our care providers working to the top of their license and doing everything that they can to provide care to the patient in the most efficient, most cost-effective manner in the time frame that the patient desires.
Nurse-only visits are a way for us to meet our patients' needs. Patients want to come to their own clinic. They don't want to go to urgent care. They don't want to go to other sites to receive their medical care. They want to come to their primary doctor.
From my perspective, these are visits that a lot of times would not have happened in our clinic itself, and they wouldn't necessarily have been seeing me, that they would have been coming to urgent care here in the evenings or on weekends, or that they would have gone to Minute Clinic or some other source. And I thought that the most important thing was that we provide the care to the patient in the quickest, most expeditious way possible. The other time that I found them useful, we still round in the hospital, and when we round in the hospital, we're not here in clinic. But sometimes I'll have patients that have something that needs addressed that would be much easier for me to talk with a patient that I know rather than one of my partners. And I've done virtual visits when I'm rounding at the hospital. I thought the advantage of offering this protocol here is that we're solidifying their patient's experience here with Fairview. And if there was something that was going on that needed more care, the nurse was concerned because the patient thought that they had strep throat, but they were also having abdominal pain and throwing up, and she thought, well, maybe there's something more going on. I can see them. I can be right here. I can, add them right onto my schedule, get them seen, and get them addressed and taken care of. We have a lot of competitors on the market in terms of Minute Clinics or other retail clinics. And our nurse-only visits allow us to compete with those, but keep the patients in our system so that we know what's going on with them.
Working in triage, I talk to a lot of patients on the phone, and many times I get, can't I just come in for a strep test? Well, in the old world, the answer was no. We were not set up to do that, so we would refer patients to after-hours clinics. So this has been a huge patient satisfier.
A virtual visit is a way of interacting with a patient in a more formal way through a visit, but one that they're not here in person. And the options are either MyChart e-visits or else phone visits. Obviously, the disadvantage of that is we don't have the patient here in person. We can't get vital signs. We can't see them. It doesn't work for rashes or something that you have to actually see or touch them. But there are some things that it can be quite helpful in terms of adjusting medications for, say, a patient with depression who might be having side effects, somebody where their bone density came back and shows that they have osteoporosis and they need to be on medications, but you want to have a discussion for them about how to take the medications, what side effects they might have.
A virtual visit is another way that we're trying to meet patients' needs. Meet them where they are. And patients they're very open to that. It's more convenient. They don't have to leave work. They're typically much quicker visits. Same goes with MyChart. We have e-visits where a patient can, contact their provider, document all of their symptoms, and they can go back and forth that way. So they're just ways that we're trying to meet our patients' needs.
The nurse-only visits have much more of a protocol to them. Currently, we have urinary tract infection, vaginitis, pink eye or conjunctivitis, and strep throat, and we're working on a sinus protocol. And those protocols are ones that we would expect that the nurses would be following pretty directly.
First of all, you need to have clear guidelines. People need to really understand what their role is. So communication, training, so that the person understands what they're supposed to be doing. You need to have trust. Providers need to trust that when the RN sees the patient, that they're following the protocols, they're prescribing the way they need to be. And also, there are times when, even though you have a patient, they fit the criteria, you still might have a question after your assessment that you would huddle with the provider.
There are always challenges in everything that we do in care model innovation because it's a change and people are used to doing things the way that we have been doing them. With nurse-only visits, the issue a lot of times is making sure that the communication is there and that the physicians feel comfortable with the protocols and what the nurses are going to be doing, and the nurses feel comfortable that if they don't think a patient fits, no matter what the protocol says that they can approach the physician.
Trust your RNs, the materials out there, the supports out there, to do what they were trained to do, and that is their assessments, work off standing orders, and watch your customer satisfaction go through the roof.
I have found care model innovation to be one of the best things that's ever happened to my work life. I've been here at Fairview for about 9 years now and have seen a number of attempts to change care and change how the clinic runs, and I think that this is the thing that I've seen that really has been by far the most successful.
If I had the opportunity to go back to the old way of doing things versus what we're doing in CMI, I absolutely would not. I want to keep moving forward.